Thank you. Tiene la palabra Advocates for Human Rights.
Mr. President, the Advocates for Human Rights welcomes the panel on public policies on COVID-19. The Advocates conducted fact-finding to learn how state and local government in Minnesota responded to violence against women during the pandemic. Under COVID-19, victims had more immediate needs to weigh against reporting abuse or accessing support. Job loss, financial and food insecurity, children schooling at home, and evictions increase the strain on victims and their families. Many victims chose not to seek help after experiencing violence in the home because they were in crisis mode. Victims needed more financial support. Paying for rent was a challenge because resources were not readily available to help. Job losses were another factor. Many victims either lost their jobs or took new jobs that placed their health at risk due to greater potential for exposure. When victims are financially dependent on their abuser, that impacts their safety. Victims who cannot access financial assistance through family courts may stay with their abuser. Fears of contracting the virus also hindered victims from seeking help. Some victims did not report abuse because they did not want the abuser to go to jail for fear they would contract the virus there. Victims also avoided seeking medical care after being assaulted due to concern about contracting COVID-19 in a hospital setting. For many victims, dealing with domestic abuse or sexual assault could not be their priority during the pandemic. Rather, victims were concerned with taking care of their children, avoiding the virus, and dealing with financial issues. The Advocates for Human Rights recommends that states take into account these factors in local and national policies and responses to COVID-19. In particular, decision makers should consult victims and the groups that serve them to best understand and address their needs when developing policies for recovery and prevention of violence against women.
Thank you.